All right, everyone, welcome back. Today we're diving deep into something I'm sure we're all familiar with, Legionnaire's disease.
Yeah.
But I think you'll find that even for us medical microbiologists, there's some really interesting insights that we can glean from some of these resources, like Microbiology. We also looked at the CDC and Microbe Canvas.
It's always good to go back and look at things you think you know a lot about.
Exactly. And especially with a bacteria as interesting as Legionella. So, we all know that it causes this atypical pneumonia.
Right.
Primarily caused by Legionella pneumophila. But one of the things that I found really interesting was this symptom of relative bradycardia.
Yeah.
Which, you don't see in every pneumonia.
It's definitely peculiar, right?
Yeah.
Because you would think with the fever you would have, an elevated heart rate.
Right.
But this bradycardia, it might be related to Legionella's ability to mess with the host cell signaling pathways. Maybe affecting heart rate regulation.
Interesting. So it's really manipulating our physiology in some pretty profound ways. And, speaking of mysteries, diagnosing Legionnaires can be quite a challenge. The CDC states something like 90% of cases are actually missed.
Wow.
Even in developed countries.
That's a lot. Yeah.
It is a lot. So why do you think that is?
Well, I think part of it is that the symptoms are really diverse, right? It can look like other respiratory illnesses, and then you get these sort of curveballs like diarrhea, which can really throw off clinicians.
Yeah, it makes you wonder if it's almost intentionally trying to disguise itself. So how do we sort of unmask this microbial trickster?
Right.
The urine antigen test is a popular choice, but Microbiology points out that there are some limitations there.
Yeah, the urine antigen test is great for quick results, and it's useful for outbreaks, but it only picks up Legionella pneumophila serogroup 1.
Right. So it could miss a good chunk of cases.
Yeah, it could miss other serogroups and other species.
So good first step, but not the be-all and end-all. Now, what about culture? I mean, that's the gold standard, but Microbe Canvas suggests that it can be a little tricky.
It can, yeah. Culture is definitely the way to go if you want to get the specific species and subtype.
Right.
Which is important for tracking outbreaks. But it's really finicky. Legionella it needs special media and specific conditions to grow.
So almost like growing orchids or something. Very specific.
Very specific.
And then, of course, there's antibody testing. Where does that fit into the picture?
Yeah, antibody testing can be useful retrospectively, right?
Right.
But it requires 2 blood samples taken a few weeks apart.
Okay.
So it's not so useful for immediate treatment decisions, but it can be good for looking back and confirming past infections.
So it seems like having a high index of suspicion is really important, right?
Absolutely.
Knowing the patient's risk factors, their travel history,
Yeah.
And really considering Legionnaires, especially if they've been in environments that might have Legionella. And speaking of sources, one of the biggest myths out there is that it spreads from person to person.
Right.
All of the sources that we looked at were very clear about that. It's really about inhalation.
Right. Inhalation of aerosolized water that's contaminated with the bacteria.
So things like cooling towers, AC units, I think even hot tubs, decorative fountains, they're all potential breeding grounds.
Oh, yeah. All those large water systems, if they aren't maintained properly, they can definitely harbor Legionella.
That explains why you see outbreaks in places like hotels and hospitals and cruise ships.
Absolutely.
They all have these complex water systems, and it really highlights the importance of understanding the environmental preferences of Legionella, right?
Right.
These bacteria have a pretty specific temperature range where they really thrive.
Yeah, they love that warm water. Ideally, between 25 and 45 degrees Celsius.
So, knowing this can really help us to implement preventive measures, right?
Absolutely. Keeping water temperatures outside of that range can really reduce the risk of growth.
Yeah, so regular maintenance and disinfection of these water systems is absolutely paramount. Now, anyone can get Legionnaire's disease, but there are certain groups that are more susceptible, right?
Yes, that's right. Middle-aged and older individuals, smokers, people with chronic lung conditions, and those with renter immune systems are definitely at increased risk of serious complications.
So again, those underlying health conditions really make a difference.
Yeah.
Now, this is where it gets really cool from a microbiological perspective.
Yeah.
Let's kind of delve into how Legionella actually invades our bodies.
Okay.
So from what I gathered, it all starts with inhalation, right?
Yes. The bacteria are inhaled deep into the lungs in these tiny droplets of water. and they actually reach the alveoli, those air sacs that are responsible for gas exchange.
So it's like a microscopic invasion.
It is. It is. And then our immune system's first responders, the macrophages, they come rushing in to try and engulf these invaders.
Right, so the macrophages, they usually just gobble up the bacteria, right?
Yeah, they're usually very good at it.
So what's different here? How does Legionella sort of evade that?
Well, Legionella has a few tricks. Instead of being digested by the macrophage, it actually hijacks the cell. It turns it into a factory to make more bacteria.
Wait, so it actually takes over the very cell that's meant to destroy it?
It does. It's remarkable.
That is incredible. So how does that work? What's the mechanism there?
So once it's inside the macrophage, Legionella uses what's called a secretion system.
Okay.
And it injects these proteins into the host cell. And these proteins, they manipulate the signaling pathways in the macrophage. They prevent the phagosome that contains the bacteria from fusing with the lysosomes.
Okay, so the lysosomes, those are the ones with all the digestive enzymes, right?
Exactly.
So it's basically disarming the macrophage's weapon system.
Exactly. It prevents the macrophage from destroying it, and it just multiplies.
So it can just multiply and multiply unchecked. That's amazing. It's a really smart strategy from a bacterial perspective. It makes you realize just how complex these microscopic battles are.
They really are.
So once it's established itself inside these macrophages, what happens next?
Well, the bacteria keep multiplying until the macrophage bursts, releasing more bacteria to infect other cells.
So it's just this vicious cycle.
It is. And this whole process triggers inflammation in the lungs. And that leads to the symptoms, the cough, the fever, the difficulty breathing.
So it's like this cascade of events that ultimately lead to pneumonia.
Exactly. And as it progresses, it can even spread to other organs. And that can cause some pretty serious complications.
So it sounds like it's a race against time to stop this microbial takeover. How do we fight back? What happens when this battle escalates into a full-blown infection? How do we manage it clinically?
That's a great question. And that leads us perfectly into the next part of our deep dive.
Stay tuned. We'll be right back.
So let's talk about treatment. When it comes to fighting Legionnaire's disease, we've got to bring in the big guns.
Antibiotics, of course.
But it's not as simple as just picking any antibiotic, right?
Right, because we have to remember Legionella is living inside those macrophages.
Exactly. So we need something that can actually get in there.
So something like penicillin or a cephalosporin, those wouldn't be effective.
Not really, no. Their intracellular penetration is pretty limited. Our sources point to macrolides, fluoroquinolones, and tetracyclines. Those are the ones that can reach those intracellular hiding spots.
So within those classes, what are some of the specific antibiotics that we'd consider?
Well, for macrolides, azithromycin and clarithromycin are good options.
Okay, so those are pretty commonly used. I've seen azithromycin used a lot for just general pneumonia, so it's good to have something that's familiar and usually well tolerated.
Yeah, definitely. And then for fluoroquinolones, levofloxacin and moxifloxacin, those are often the go-to choices for more severe cases.
Makes sense. Especially if someone's hospitalized, you want something strong.
Right. And then there's doxycycline. That's the tetracycline usually used for Legionnaires.
So a good backup option if someone can't take a macrolide or a fluoroquinolone.
Exactly. It's all about finding that balance, efficacy, safety, what's best for the individual patient.
It's like a puzzle. You have to find the right piece. Now, what about prognosis?
Mm-hmm.
The CDC says that the fatality rates can be as high as 30%.
Yeah, that's pretty significant. It really emphasizes how important it is to treat it quickly.
The sooner the better, before it has a chance to really take hold.
Absolutely. But it's not always that straightforward. There are other things that affect the outcome.
Like what?
Well, the patient's overall health, right? If someone has a lung disease or a weakened immune system, they're going to have a harder time fighting it off.
It's like they're already fighting one battle and then this comes along.
Exactly. And the severity of the infection initially, that also matters. If someone comes in with really severe pneumonia, they're at higher risk of complications.
So it's a combination of things. How quickly it's treated, the patient's overall health, how bad the infection is to begin with. Now, switching gears a little bit, let's talk about prevention.
Okay.
Prevention is always better than cure. But how do you prevent something that's lurking in our water systems?
It's a tough one. The key is really controlling those environmental sources, making sure that Legionella doesn't have the right conditions to grow.
So those cooling towers,
Yeah.
hot water tanks,
Yeah.
AC systems, all of those things, making sure they're properly maintained.
Exactly. Regular maintenance, disinfection, making sure the water temperatures are either hot enough to kill the bacteria or cold enough to stop them from growing.
Right, so no stagnant water.
Exactly. And for healthcare facilities, it's even more important.
Yeah, because you have patients who are already more vulnerable.
Exactly. They need to be extra vigilant, monitoring water quality, having good water management plans in place, and investigating any suspected cases right away. It's all about teamwork,
Wow.
Building managers, infection control, and of course us, the medical microbiologists.
We all have to work together. Now, we've talked a lot about the traditional approaches to managing Legionnaires.
Yeah.
But what about the future? Are there any exciting new developments on the horizon?
There are, and that leads us perfectly to the last part of our deep dive, where we'll look at the cutting-edge research that could really change how we fight this disease.
Okay, so we're back and ready to wrap up our deep dive into Legionnaire's disease. We've talked about the symptoms, the challenges of diagnosing it, how it actually infects our cells, and how we treat it and try to prevent it. But let's shift gears a bit and look towards the future. What's on the horizon? What's got you excited?
Well, one of the most exciting prospects is a vaccine.
Oh, wow. A vaccine for Legionnaires. That would be amazing. Think about the impact that could have, especially for those who are more vulnerable.
Absolutely. It would be a game changer.
So what are the approaches? How would they even go about developing a vaccine for this?
Well, there are a couple of strategies. One is to target the proteins or sugars on the surface of the bacteria,
Right.
the things that it uses to attach to and get into our cells. If you can trigger an immune response against those targets.
Then you could prevent infection altogether.
Exactly.
Wow. And are there other approaches as well?
Yeah, another approach is to use a weakened or inactivated form of the bacteria, kind of like a more traditional vaccine approach.
So it's like giving our immune system a preview.
Right, a sneak peek so it's ready to fight back.
Now, Legionella is a tricky one.
It is. There are lots of different serogroups and virulence factors. So developing a vaccine that's effective against all of them, that's a big challenge.
But it's promising, right? It's something that's being actively pursued.
It is, and there's a lot of optimism in the field.
Well, that's good to hear. But in the meantime, we still have to deal with the issue of antibiotic resistance.
Yeah.
Are there any new antibiotics being developed specifically for Legionella?
Yeah, researchers are looking at new classes of antibiotics that target different pathways in the bacteria.
So trying to outsmart those resistance mechanisms.
Exactly. And there's also a lot of interest in alternative therapies, like using antibodies or even bacteriophages.
Bacteriophages. Now, those are viruses that infect bacteria, right?
Right. So it's like using nature's own weapons against these pathogens.
It sounds almost like science fiction, like these tiny viruses fighting these dangerous bacteria. But are there any downsides? Any challenges with using phages as therapy?
Oh, there are definitely challenges. You have to find phages that are very specific to Legionella. You don't want to harm any of the good bacteria in the body.
Right.
And there's also the possibility that the bacteria could develop resistance to the phages. But it's a very active area of research.
So a lot of potential there. Well, this has been a fascinating discussion. We've learned so much about Legionella, the unusual symptoms it can cause, those diagnostic dilemmas, the intricate way that it interacts with our immune system, and then all of these exciting developments in treatment and prevention.
It really highlights how much there is still to learn, even about a bacterium that we thought we knew pretty well.
And for our listeners who want to delve even deeper into the world of Legionella, we encourage you to check out some of the resources that we mentioned earlier. Microbiology, the CDC website, and Microbe Kansas.
They're all excellent sources of information.
Well, that wraps up our deep dive into Legionnaire's disease for today. Until next time, stay curious, keep learning, and thanks for joining us.